Cognitive Behavioral Therapy, CBT. Introduction. Cognitive behavioral therapy, CBT, is a widely used and highly effective psychotherapeutic approach designed to address a range of mental health issues. Developed in the 1960s by Aaron T. Beck, CBT is grounded in the understanding that our thoughts, feelings, and behaviors are interconnected, and that changing maladaptive thoughts can lead to changes in emotions and behaviors. This comprehensive guide will delve into the principles, techniques, applications, and effectiveness of CBT. History and development of CBT. Origins and early development. CBT's origins can be traced back to the early work of Aaron T. Beck, a psychiatrist who initially trained in psychoanalysis. Beck's research in the 1960s led him to develop a different approach after he observed that patients engaged in a form of internal dialogue that influenced their emotions. He coined the term automatic thoughts to describe these spontaneous, often negative thoughts that could contribute to emotional distress and behavioral problems. Evolution and integration of behavioral techniques. CBT evolved by integrating principles from behavioral therapy, which emphasizes the role of learning and conditioning in shaping behavior. Behavioral therapy's techniques, such as exposure therapy and systematic desensitization, were combined with Beck's cognitive approaches to create a more holistic treatment method that addresses both thought patterns and behavioral responses. Expansion and modernization. Over the decades, CBT has expanded and adapted to treat a variety of mental health conditions. Innovations in technology and research have further refined CBT techniques, making them more accessible and tailored to individual needs. Today, CBT is a cornerstone of evidence-based psychological treatment, widely used in clinical settings and recommended by mental health professionals globally. Core principles of CBT. Cognitive restructuring. One of the fundamental principles of CBT is cognitive restructuring, which involves identifying and challenging distorted or irrational thoughts. By restructuring these thoughts, individuals can develop more balanced and realistic thinking patterns, leading to improved emotional well-being and behavior. Behavioral activation. Behavioral activation focuses on increasing engagement in positive and meaningful activities to combat depression and other mood disorders. This principle is based on the idea that inactivity and avoidance can exacerbate negative feelings, while participation in rewarding activities can enhance mood and overall functioning. Problem solving. CBT emphasizes the development of effective problem-solving skills. This involves identifying specific problems, generating potential solutions, evaluating the pros and cons of each solution, and implementing the most effective strategy. Enhancing problem-solving abilities helps individuals manage stress and navigate life's challenges more effectively. Exposure therapy. Exposure therapy is a crucial component of CBT, particularly for anxiety disorders. This technique involves gradually and systematically exposing individuals to feared situations or stimuli in a controlled manner. Through repeated exposure, the fear response diminishes, and individuals learn to confront their fears without avoidance. Mindfulness and acceptance. In recent years, mindfulness and acceptance-based strategies have been integrated into CBT. These approaches encourage individuals to observe their thoughts and feelings without judgment and to accept their experiences rather than trying to control or avoid them. Mindfulness techniques can help individuals develop a greater awareness of their thought patterns and cultivate a more compassionate and accepting attitude towards themselves. CBT techniques and interventions. Thought records. Thought records are a common CBT tool used to track and analyze automatic thoughts. Individuals are encouraged to write down situations that trigger distressing emotions, the thoughts associated with these situations, and the resulting feelings and behaviors. By examining these thought records, individuals can identify cognitive distortions and work on developing more balanced thoughts. Socratic questioning. Socratic questioning is a technique used to challenge and reframe maladaptive thoughts. Therapists ask open-ended questions to help individuals explore the evidence for and against their thoughts, consider alternative perspectives, and develop more rational and balanced conclusions. Behavioral experiments. Behavioral experiments are designed to test the validity of negative thoughts and beliefs through real-life experiences. Individuals are encouraged to engage in activities that challenge their fears or assumptions, allowing them to gather evidence that contradicts their negative thinking patterns. Relaxation techniques. CBT often incorporates relaxation techniques, such as deep breathing, progressive muscle relaxation, and guided imagery, to help individuals manage stress and anxiety. These techniques can reduce physiological arousal and promote a sense of calm and relaxation. Activity scheduling. Activity scheduling involves planning and organizing daily activities to increase engagement in enjoyable and meaningful tasks. This technique is particularly useful for individuals with depression, as it helps them break the cycle of inactivity and loss of interest. Graded exposure. Graded exposure is a structured approach to facing fears gradually. Individuals create a hierarchy of feared situations and start with the least anxiety-provoking scenario, gradually working their way up to more challenging situations. This technique helps individuals build confidence and reduce avoidance behaviors. Applications of CBT. Depression. CBT is one of the most effective treatments for depression. It helps individuals identify and challenge negative thought patterns, develop coping strategies, and engage in activities that improve mood. Research has shown that CBT can significantly reduce depressive symptoms and prevent relapse. Anxiety disorders. CBT is highly effective for treating various anxiety disorders, including generalized anxiety disorder, GAD, social anxiety disorder, panic disorder, and phobias. Techniques such as exposure therapy, cognitive restructuring, and relaxation training help individuals manage anxiety and reduce avoidance behaviors. Post-traumatic stress disorder, PTSD. CBT is a first-line treatment for PTSD. Trauma-focused CBT, which includes techniques such as prolonged exposure and cognitive processing therapy, helps individuals process traumatic memories, challenge distorted beliefs, and reduce symptoms of PTSD. Obsessive-compulsive disorder, OCD. CBT, particularly exposure and response prevention, ERP, is the gold standard treatment for OCD. ERP involves exposing individuals to feared situations or thoughts without allowing them to engage in compulsive behaviors, helping to reduce anxiety and compulsions over time. Eating disorders. CBT is effective for treating eating disorders such as anorexia nervosa, bulimia nervosa, and binge eating disorder. It addresses distorted body image, unhealthy eating patterns, and underlying cognitive distortions, promoting healthier behaviors and attitudes towards food and body image. Substance use disorders. CBT is widely used in the treatment of substance use disorders. It helps individuals identify and change thought patterns and behaviors that contribute to substance use, develop coping skills to manage cravings and triggers, and prevent relapse. Insomnia. CBT for insomnia, CBTI, is a structured program that helps individuals change thoughts and behaviors that interfere with sleep. Techniques include sleep restriction, stimulus control, cognitive restructuring, and relaxation training, which improve sleep quality and duration. Chronic pain. CBT is effective in managing chronic pain by addressing the psychological factors that contribute to pain perception and coping. Techniques such as cognitive restructuring, relaxation training, and activity pacing help individuals reduce pain-related distress and improve functioning. Effectiveness of CBT. Research and evidence base. CBT is one of the most extensively researched forms of psychotherapy. Numerous studies and meta-analyses have demonstrated its effectiveness in treating a wide range of mental health conditions. The evidence base for CBT is robust, with strong support for its efficacy and long-term benefits. Comparisons with other therapies. CBT has been shown to be as effective as, or more effective than, other forms of therapy for many conditions. For example, CBT is often compared to medication for depression and anxiety, with research indicating that CBT can be equally effective, particularly in the long term. CBT also compares favorably to other psychotherapeutic approaches, such as psychodynamic therapy and humanistic therapy. Long-term benefits and relapse prevention. One of the key advantages of CBT is its focus on skills acquisition and relapse prevention. Individuals learn practical tools and strategies that they can continue to use long after therapy has ended. This emphasis on self-help and maintenance contributes to the long-term benefits of CBT and reduces the risk of relapse. Accessibility and adaptability. CBT is highly adaptable and can be delivered in various formats, including individual therapy, group therapy, online therapy, and self-help programs. Its structured and time-limited nature makes it accessible to a wide range of individuals, including those with limited access to traditional therapy settings. CBT in practice. The therapeutic process. CBT typically involves a structured and collaborative therapeutic process. The therapist and client work together to set goals, identify and challenge negative thought patterns, develop coping strategies, and implement behavioral changes. Sessions are usually time-limited, with a focus on specific issues and practical solutions. The role of the therapist. CBT therapists play an active and directive role in the therapeutic process. They provide education about the cognitive behavioral model, guide the client through various techniques and interventions, and offer support and feedback. The therapist-client relationship is collaborative, with an emphasis on teamwork and mutual respect. Homework and between-session activities. Homework assignments are a crucial component of CBT. Clients are encouraged to practice skills and techniques learned in therapy between sessions. These activities might include keeping thought records, conducting behavioral experiments, practicing relaxation techniques, or engaging in planned activities. Homework helps reinforce learning and promotes the generalization of skills to real-life situations. Measuring progress and outcomes. CBT places a strong emphasis on measuring progress and outcomes. Therapists often use standardized assessment tools and self-report measures to track changes in symptoms and functioning over time. Regular monitoring allows for adjustments to the treatment plan and ensures that therapy is on track to meet the client's goals. Challenges and criticisms of CBT. Accessibility and availability. While CBT is widely recognized as an effective treatment, accessibility and availability can be a challenge. There may be a shortage of trained CBT therapists in certain areas, and waiting lists for therapy can be long. Additionally, some individuals may have difficulty accessing therapy due to financial constraints or lack of insurance coverage. Suitability for complex cases. While CBT is effective for many conditions, it may not be suitable for all individuals or complex cases. Some clients may have deep-seated issues or trauma that require more intensive or specialized interventions. In such cases, an integrative approach that combines CBT with other therapeutic modalities may be necessary. Cultural sensitivity and adaptation. CBT was developed in a Western context, and its principles and techniques may not always align with the cultural beliefs and practices of individuals from diverse backgrounds. It is important for therapists to be culturally sensitive and adapt CBT to meet the unique needs and values of each client. Overemphasis on cognition. One criticism of CBT is that it may overemphasize the role of cognition in mental health and underplay the importance of emotions and relational factors. While CBT has incorporated more effective and relational components in recent years, some critics argue that it still falls short in addressing the complexities of human experience. Future directions in CBT. Technological innovations. Technological advancements have opened new avenues for delivering CBT. Online and digital platforms, such as teletherapy, mobile apps, and virtual reality, are making CBT more accessible and convenient. These innovations can help bridge the gap in access to therapy and provide additional resources and support for clients. Integration with other therapies. The future of CBT may involve greater integration with other therapeutic approaches, such as mindfulness-based therapies, acceptance and commitment therapy, ACT, and dialectical behavior therapy, DBT. Combining CBT with these approaches can enhance its effectiveness and address a broader range of psychological issues. Personalized and precision CBT. As our understanding of individual differences in mental health grows, there is increasing interest in personalized and precision approaches to CBT. Tailoring CBT interventions to the unique needs, preferences, and characteristics of each client can improve treatment outcomes and ensure that therapy is more effective and relevant. Expanding applications. CBT continues to expand its applications beyond traditional mental health settings. It is being used in areas such as health psychology, pain management, and rehabilitation, as well as in educational and occupational settings. The versatility and adaptability of CBT make it a valuable tool for addressing a wide range of challenges and promoting overall well-being. Conclusion. Cognitive behavioral therapy, CBT, is a powerful and evidence-based approach to mental health treatment. Its principles, techniques, and interventions have been proven effective for a wide range of conditions, making it a cornerstone of modern psychotherapy. As CBT continues to evolve and adapt to new challenges and innovations, it remains a vital tool for helping individuals achieve lasting change and improved quality of life. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.